All right, it's 5:30 and it's time for the November 4th meeting of the Douglas County Board of County Commissioners. We want to welcome any of you who are at the Douglas County Courthouse or joining on us online. I just want to pass on a bit of information regarding how we run our meetings on Zoom during this time of social distancing. If visual aids are used during the meeting, the presenter will share the screen with the call. Participants will not be able to view them without a computer, smartphone, or tablet. All participants will be entered into the meeting with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be unmuted when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their line when not speaking. Please introduce yourself each time you speak. If you have public comment on an agenda item or under regular public comment, please use the raise your hand function of Zoom. Staff will call on you and unmute you. We ask that speakers give their names and address for the minutes. The county does reserve the right to shut off the microphone or remove any speaker from the meeting if they're vulgar, rude, or inappropriate. The chat function has been disabled and a recording of this meeting will be available on our website after the meeting. We have a more robust agenda than we've had in maybe recent weeks. We have 4 consent agenda items, 4 regular agenda items, appointments, general public comment, and then we'll finish with commissioner and administrator miscellaneous. Commissioners, is there any item on the consent agenda that you would like to have removed for further discussion?
No, I don't have anything.
Thank you. Sarah, is there anybody there at the courthouse who has a consent agenda item they'd like to have pulled?
Nope.
And Jill Jolliker, I think, is monitoring for us online. Jill, is there anybody online?
No.
Thank you, Jill. With that, I've taken a motion to approve items 1, 2, 3, and 4 of our consent agenda.
Move to approve. Second.
Moved by Commissioner Thelman, second by Commissioner DeRusso. All those in favor say aye.
Aye. Aye.
Aye, passes 3-0. Now we'll move on to our regular agenda. The first item is to consider a recommendation for contract for brokerage services. It's an administrative item, so we'll turn it over to Sarah.
Thank you, commissioners. In your packet is a recommendation for a contract related to brokerage services for our property and liability insurance and our workers' compensation related brokerage services. Douglas County had been a long period of time since we had done a RFP process for brokerage. And so we issued an RFP and invited brokers to submit a proposal to help us with this services. And I think it's one of the things that I don't think everybody always understands what brokerage really is. And so I might just explain that for the folks that are listening. The county is fully insured for its property insurance and its automobile insurance and its liability insurance. And for the most part, with those coverages, our insurance provider is Travelers Insurance. What the broker does is sort of works between the insurance carrier and us as the owner or as the client, and helps us navigate the selection of those carriers. It can help us sometimes with claims management, and it's a very helpful service because they really understand that marketplace way better than we do and can help us navigate that world. But it is not the insurance carrier itself. It is simply the folks that help us get the insurance carriers. Does that make sense? And then in terms of workers' compensation, the county is fully is self-insured for workers' compensation. So the only insurance coverages we have for workers' compensation are for what we call excess coverage. So at the very top of our exposure, the costs to us, we have insurance to help us with that piece. But often a broker can help us pick a third-party administrator, which we're required to have by the state of Kansas. So they can help us with the RFP selection process for that third-party administrator. And they can be helpful in helping us navigate claims. Oftentimes too, brokers can provide a wide variety of services for safety and education and resources, and they can really be a great advocate and a resource to us as we administer our plan. I would say these two pieces are really what I would broadly call under the umbrella of risk management services that are managed out of the administration department in my team. We do have one other place where we use brokerage, and that is with health insurance and our self-insured health insurance fund. Many of these providers do all three services, some don't. So when we initially approached this RFP, our plan was to really just do brokerage services for our fully insured lines of property and liability coverages. As we went through the RFP and interview process, we realized that there were really substantial savings by us having our brokerage for both the property and liability piece and workers' compensation together. That sort of economy of scale for a broker who can do both can really provide us with substantial value. And I think you can see that on the attachment as to when we are able to bundle those two together, the kinds of savings we could get. In the past, Douglas County had been using a commission-based approach to pay for these brokerage services, which means there was a commission put on the insurance itself, and that's how the broker got paid. It's probably a little bit more modern practice to have a separate fee schedule where it's very transparent and upfront as to what the cost is for those services. So we asked all the RFP respondents to propose a fee-based schedule. In the attachment, you see the results of that. I'm going to just look at it myself. So you can see the results of what we had been, what everybody turned in terms of their cost breakdown. We had been with Willis Towers Watson for a substantial period of time. We did enter some negotiations with them in some ways to clarify their cost proposal, and also as our current carrier, they reduced their proposal, so you see it there as a reduced proposal. However, it is the recommendation of staff, the staff team, which included myself, Julie Sackrider, who is our management and information analyst who helps me manage our risk management work, and Jackie Wagner, our purchasing director, that we go with locked-in services instead. The savings is substantial, and we believe locked-in is a extremely well, a very reputable organization with substantial resources available to it. They are, they're I think national or international headquarters are in Kansas City. So it's a really great company to have so close. They provide similar services for Johnson County and City of Wichita, I believe. And our recommendation would be to switch our brokerage to locked-in. And I'd stand for any questions the commission might have. And Jackie's also available if you've got questions for her.
I want to clarify, Sarah, because you went through the numbers there. If we had still used a commission-based, we're looking at about $355,000 based on assuming that nothing would go up, right?
Correct.
Yeah, and then this would be 191, which would be, like you said, substantial savings. I just want to make sure we're articulating that.
Correct. And
it's helpful for me to hear you say that you're not worried about. I was sort of concerned about the difference in those bids was substantial, to be honest, and I was a little bit concerned about that. So I was glad to hear you talk that through.
Yeah, our staff team had additional conversations and negotiations with Lockton to talk through their proposal and the services that they provide, particularly in the aspects of workers' compensation, to make sure that we're comfortable with that work. We really do believe that we're going to be able to develop a good working relationship with them, and they have strong relationships with our current providers and carriers. And that's really what's important here is a broker, they're helping us manage that relationship between, they have to have a good relationship with the carrier and then help us manage a good relationship with that carrier as well. But so we are comfortable with this switch. What I do want to point out for those that might be listening, that those numbers of 191 is over a 5-year time frame. It's those costs are not annual.
Commissioners, any questions?
I don't have any.
Any member of the public like to speak on this item? You can just let Sarah know if you're there at the courthouse or raise your hand if you're online.
I don't have anyone here at the courthouse.
Thanks, Sarah.
And I'm not seeing anyone online.
All right. So anybody like to make a motion on our brokerage service contract?
Sure. Move to approve a brokerage service contract to Lockton Companies for general liability insurance and workers' comp in the amount of $191,000 for a 5-year term.
Second.
Moved and seconded. All those in favor say aye.
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 Aye. Approved 3-0. Thank you for your work on that, Sarah, and your team. It's nice to hear that we saved the county some money. Let's move on to a planning department item. Consider site plan SP 20-00329 for a religious institution at 588 North 1200 Road. And Mary Miller, I believe, is our planner on this.
Yes, good evening. I am Mary Miller, City County Planner. And as you mentioned, this is a site plan. I will start sharing my screen for my presentation. This is a site plan proposing the relocation and rebuilding of the Clinton Presbyterian Church at 588 North 1200 Road. The property is northwest of the unincorporated town of Clinton, and it actually consists of 2 parcels. The southern parcel that had the former church is about 2.8 acres, and the northern parcel where the church will be rebuilt is about 5 acres. And the subject property, it contains a residence and outbuildings on that southern parcel, and you can see where the church was in the middle of that circular driveway. And the plan is to relocate the church up to the north. Only one leg of the circular driveway will be kept, and that driveway will lead up to the parking lot. The parking lot will be south of the church, and there will be a one-way drive that circles the church. That western leg of that access drive will be removed, and that will be planted to grass, so that it'll just have the one access point on the road. This is a detail from the site plan. This is reviewed with the review criteria in the zoning regulations. And under the current code in the Ag 2 zoning district, and even the Ag 1 district, a church requires approval of a conditional use permit. However, if you had a use that was allowed by right before the zoning regs were adopted in February of 2020, then they have automatic conditional use permit status. And so with this change, that's seen more as just a change to the site. And so it can be approved with a site plan rather than requiring a new conditional use permit. The properties are both vested parcels. The zoning director determined that both parcels are vested as they were created in conformance with the regulations that were in place at the time. And there have been no changes to their legal description or configuration since then. As noted in the staff report, the structure is compliant with the dimensional standards in the Ag 2 district, and the parking and access drive will be gravel except for the accessible ADA parking spaces, which would be paved. And lighting is always one of the most impactful components of development in the rural areas. And so I've circled in yellow where lighting is either existing or proposed. And down close to East 1200 Road, there will be 2 full cutoff light fixtures. All the light fixtures will be leased from Free State Electric, but the 2 along the road will be full cutoff light fixtures. The one more to the north, that's a security fixture that's already in place for this residence. And then up by the parking areas, there'll be 2 pole lights, again, Free State lighting. There'll be full cutoff fixtures. And then there will be canopy lighting under this canopy that's the drop-off area, but these will be recessed in the top of the canopy, so they shouldn't have any glaring impact. Safe vehicular access will be provided. For one thing, we are removing that western leg of the circular drive. There'll just be one access point. It'll be a 2-way drive coming into the church. Where it circles the church, this will be one way, and also it'll just be one way where the drop-off is. And as I mentioned, there are 2 parcels, and you can see the parcel line. And usually when you have a access that crosses another parcel, we have to do an access easement to ensure you have access, but you cannot dedicate an easement to yourself. And so with this site plan, an access easement is not required, but there is a note on the site plan that notes that in the event one of these parcels is sold or the ownership transfers, that an access easement would be dedicated just to ensure continued access for the church. This is an example of the kind of building they're putting in. This is very compatible with other buildings in the area. And staff recommends approval of the site plan based on the findings in the staff report, and then subject just to that one condition that that western leg of the circular drive be removed and seeded with grass prior to the release of the certificate of occupancy. And I'm happy to answer your questions if you have any, but I know the applicant is also here today, I believe.
Thank you, Mary. We may have some questions here. Let's go ahead and hear from the applicant.
Good evening, commissioners. I'm Stan Hernley. I'm the project architect. Shay Keeler is also on the call. He's the contractor for the project, and I believe there are some representatives for the church also. As you are aware, I believe what we're proposing is a new building that's a replacement for the building that burned down in August of 2019. We are planning to build back a similar kind of square footage that was there before if you add the basement to the first story footprint of the building. It's a little bit larger for the community hall space that was in the basement of the church before. So the church itself, along with being a religious facility for services, serves a really strong role in the community of Clinton also, providing meeting space. And I know that groups have had a hard time finding places to meet. And again, we will be meeting again at some point here when COVID gets past us. We've noted on the site plan for that west entrance drive to be cut off, and we'll just have the east entrance drive. I don't have much else to add beyond what Mary has presented. She did a good job with showing what we're proposing to do, and I'd be happy to answer any questions that the commissioners may have.
Thanks, Stan. We may have some as we go here. Commissioners, any questions?
I don't have any questions, but I do want to say how happy I am to see this project. As Stan said, I mean, that church was such an important part of the community. I remember going out there that morning and later in the day and catching up with some of the church leadership. And I mean, it was just, it was a really sad day for the community, but as the people in Clinton do, they're strong, and they gathered and they planned, and here we are, 15 months, it seems like a long time, but I knew they would get it done, and I'm just really excited to see it. So Stan, thank you for your help with moving this project along.
Stan, I just have a quick question about parking. I'm just curious, how was parking handled before? It doesn't really look like there was a lot before, and this looks like possibly an improvement.
You parked in the grass.
Yeah, that's what I was going to say is you park in the grass and probably along the road if it was a little bit muddy and walk to the church.
Thanks. That's what I thought, but glad to see some maybe more accessible parking than we had before. That's a great improvement. Any other questions before we open up for public comment? Is there any public comment there at the courthouse, Sarah, for this item?
We don't have anyone.
Thank you. Anyone online, Jill?
No, I'm not seeing any.
Okay, we'll bring it back for motions.
I would be very happy to make the motion. Move to approve site plan SP-20-00329 for the construction of a 4,244 square foot religious institution and associated parking on approximately 8 acres. Addressed as 588 North 1200 Road, based on the findings listed in the staff report and subject to the following condition: that the western access point on North 1200 Road shall be removed and seeded with grass prior to the release of the certificate of occupancy.
Second.
Moved and seconded. Before we vote on this, commissioners, I made a mistake and forgot to ask if there was any ex parte communication on this before we started on this item.
No, I didn't have any.
Good, and neither did I, just needed to make sure. All right, all those in favor say aye.
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 Aye, passes 3-0. Thank you, Stan. Shay, appreciate you being here. We're going to keep Mary Miller with us tonight and move on to another planning department item for the Big Springs Quarry reclamation plans at 2 North 1700 Road.
Thank you, commissioners. I will start screen sharing for this item. Mary Miller, City County Planner, and this is a review of the reclamation plans for the orange and the aqua phases of the Big Springs Quarry. This quarry was approved with CUP 18-00570, and it was filed and listed as CUP 20-00123, but that's mainly just for our documentation so we can keep track of it. It is not a new CUP. Actually, the reclamation is required with one of the conditions and restrictions of use in the approved CUP, and states that detailed reclamation plans shall be submitted for each phase of the reclamation process for review and recommendation by the planning staff and approval by the county commission. And the detailed reclamation plan shall be submitted and approved prior to opening of a quarry phase. This graphic is from the staff report, and it shows the quarry in its entirety. The areas that have Roman numerals and colors, those were approved the original 1990 CUP. The areas that are only Roman numerals and are crossed out, they were also included the original 1990 CUP, but they have been quarried, they've been reclaimed, and they have been removed from the CUP. And areas that are only colors, these were added with the 2018 change. In 2018, the area was expanded and the time limit was extended. They are currently in the purple phase, which was previously phase 6. The 2 phases with the red dots are those that currently have approved reclamation plans. So at the moment, they could move into the green phase, but they are doing the reclamation plans for the aqua and the orange, as I believe that's where they would rather move. And they've estimated that they should be finishing up the purple phase sometime next year. And then phase 1, that's the plant site, and that will be the last phase that will be reclaimed. And as with most quarry conditional use permits, there are a set of reviews that are required. So this is a table of the reviews that are required with Big Springs. An operation plan is required every 5 years. They did submit one. It was approved administratively in May of this year, and the next review will be in 2025. The reclamation plans, this list shows all those that have been previously approved, and then the ones that are submitted and are being reviewed today, orange and aqua, and then the remaining phases, blue and pink. And these must be completed before it's possible to begin coring in a following phase. And then also drainage studies required before moving into another phase. So whichever phase they decide to move into, they would need to submit a drainage study, which is reviewed by the county engineer. And once that's approved, they would be able to move forward. So in the reclamation plans, they have provided a pre-mining and a post-reclamation topography to show how things will change. This is the orange phase. And there is an error on this, and this is one of the conditions that's noted. Up in the top northeastern corner, there's a little property that is not a part of this quarry. And so one of the conditions is that this be revised just to exclude that from the quarry boundaries on all the graphics. And 2 water features are being proposed with the final reclamation. And so the cross section provided in the plan shows that the northern one will be about 45 feet deep and the southern are about 30 feet deep. So these are not extremely deep. The planned water level has them at being about 10 to 15 feet deep. And the general notes note that the topography of these sites may vary somewhat since mining hasn't occurred and they're not really sure how much they're going to extract. However, there is a range of variation, and this is the same that was approved with previous reclamation plans, that it could be 5 feet higher or 10 feet lower. And I'm afraid there's a typo in the staff report. So if you read the conditions, it says 120 feet lower, and that would just be 10 feet. So I'll mention that in the conditions that should be revised. But one of the conditions is to include that requirement that you cannot go deeper than 10 feet to the pond, so that they may be a little deeper, but they would not be more than 10 feet deeper. And any change outside this range of variation would require a revised reclamation plan, and that would have to come back to the Board of County Commissioners for approval. This graphic is from the approved conditional use permit, and it shows a setback in the northeastern corner. This is a natural area setback, and it's surrounding the residential setback. And one of the conditions is that the area that's shown as a reclamation area be revised to omit this, because there should be no quarrying in this area. It's a wooded area. And so just the reclamation, the graphic that identifies where reclamation will be occurring should omit this. And then this is for the aqua phase. It shows the pre-mining and the post-reclamation. It shows the topography. There are 2 water features in the bottom. These were done years ago with a coring of a phase to the south. These will not be impacted with this coring, but there will be a new water feature and a feature and a relocated water feature up in the northeast. And this is cross section shows how those water features will be. They're somewhat staggered. They'll both be relatively shallow, about 15 feet and 10 feet deep each. And one of the conditions of approval is that they do note that everything will be 3-to-1 slope above water, but that it should also extend to 5 feet below that planned water level, just in case someone falls in, there'll be possible for them to exit. Both phases contain wetlands as identified by the U.S. Fish and Wildlife Wetland Mapper. And so if these jurisdictional wetlands are to be disturbed with mining or reclamation activities, all required permits from the U.S. Army Corps of Engineers must be provided prior to coring commencing in that phase. And it is possible that a wetland specialist could delineate these wetlands, and they could dispute the designation with the Army Corps. And if the designation is revised, they would just need to provide planning with documentation and show where the wetlands are. And some of the conditions of approval do note that the reclamation plan should identify these wetlands, or if they are delineated, show where the others are, whatever the revised wetland areas are, and also include that note that all permits will be provided prior to coring commencing. And so staff does recommend approval of the reclamation plan subject to the conditions listed in the staff report. Page 1, general note 2 on both plans is that range of variation that should be revised to note that the 10-foot depth, if you could go 10 feet lower, would also apply to the ponds. And also the typo should be corrected. It's just 10 feet, not 120 feet. And this also mentions that the county commission approval is necessary if they exceed the range of variation. And page 1, the sequencing note 4 on both plans, that refers to the 3-to-1 slope that should be included 5 feet below the planned water level of the new water features. And page 4 of each plan should be revised to reflect the area that will undergo reclamation more accurately and omit areas that will not be mined. And orange phase graphics should be revised to remove that residential property in the northeast corner. And then the wetlands should be shown in both phases with a note that all required core permits shall be provided prior to coring any jurisdictional wetlands. And those will be provided before moving into those phases. So I'm happy to answer any questions if you have any, and the applicants are here also for this item.
Thank you, Mary. We'll hear from the applicant if they have any statement they'd like to make. While we're waiting on the applicant, commissioners, do you have any ex parte communications you need to divulge?
No.
No, neither do I.
Okay, this is Cole Anderson with Midstate Materials. Rich Eckert is here with me as well. Yeah, Mary did a good job describing the plans, and these are similar to all of our other phases that we have reclaimed and won all of our reclamation awards on. So if you guys have any questions, we're here to answer.
Thank you, Cole. Appreciate that. Commissioners, any questions on this item?
For me.
Don't have any.
Sarah, is there anybody there at the courthouse who'd like to speak on this item?
We don't have anyone.
Anyone online, Jill?
No.
Okay, well, we'll bring it back to the commission for any further discussion or motions.
I'll make a motion to approve the aqua and orange phases for Big Springs Quarry at 2 North 1700 Road, subject to the findings and the conditions listed in the staff report.
Second.
Moved and seconded. Any further discussion? All those in favor say aye.
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 Aye. Passes 3-0. Thank you, Mary. We appreciate your work. Nice reports tonight.
Thanks.
All right, our last regular agenda item is the Integrated Crisis Team expansion. And we'll turn it over to Sarah to introduce our guests as they're moved into the meeting.
Thank you, commissioners. Yeah, I'm going to turn it over to Bob Tryansky, our Director of Behavioral Health Projects, to walk us through this item. I know he's got several other folks joining us for this item as well.
Thank you, Sarah, and thank you, commissioners, and good evening to everybody. I'm joined, or happy to be joined, as always, by our partners from Burt Nash and from LMH Health. Stephen O'Neill, COO from Burt Nash, and Derek Hurst, Director of the Integrated Crisis Team, and Jeanette Kirkpatrick, who is the Vice President and the person who has been helping to shepherd, along with the other two, this whole process. It has been quite a while, actually, since it seems like only yesterday that we were in a summer study session before the budget process moved forward to talk about expanding the integrated crisis team. I want to take a couple of minutes just to kind of reorient everybody before we get into the details of this proposal. But I think what we're going to talk about tonight is an example of what we've been previewing was coming for a while, which is there's been all kinds of reasons for celebration among the partners, all kinds of reasons for celebration for the partnership between LMH and Burt Nash to create behavioral health partners to operate the crisis center. We have been cooperating, we've been collaborating, we've been communicating real well. Tonight, we're going to talk about a couple of other C words because what we are wading into here is complicated and challenging. And so I just want to sort of start off by saying, I think just to lay the groundwork, what you've got tonight is our partners really great efforts working through the Behavioral Health Leadership Coalition to sort of take a significant next step forward so that we're ready when that crisis center building comes online, and we are open 24/7 to provide emergency psychiatric services, medication-assisted treatment for substance abuse, crisis services for people who may be experiencing suicidal ideation or suicide attempt, sort of all of the levels of things that and complexities that will come to the crisis center when people in the community are struggling. So the Behavioral Health Coalition, you know, I say this every time we do this just to reorient everybody to what our mission and vision is, as defined by that coalition of partners, is an integrated system of behavioral health care that serves the whole person their whole life so they can realize their full potential. And the behavioral health goal in the community health plan is to build an integrated system of care that moves from crisis as an illness as a norm to recovery and prevention as a practice. Doing the work to build that integrated system of care is something that we have been working at for about the last 2.5 years. And the reason we're doing that work is because in our community, at the moment, there's a deficit. We don't have a 24/7 robust system of crisis care, crisis continuum that successfully meets people where they are and prevents them from, when they find themselves in a crisis, escalating to the point where they need emergency services either at the hospital or with EMS, or an interaction with law enforcement that that results in somebody winding up in jail. And so what we are trying to do is very complicated because we are trying to bring online a series of new facilities, um, and new approaches to meeting the needs of people in our community, and to be able to handle and manage and run and deliver excellence with all of the components, all of the new components of that system of care. So, in a nutshell, what we're striving to do is provide the right care in the right place at the right time. And that's what we've shared with you before. And Derek and Stephen have shared the goals for enhancing the crisis continuum of care. Number one, we've got to be person-centered. Number two, we have to increase access. We've made significant strides in increasing access. I was looking at some of the second quarter report from Bert Nash on just what we've been able to accomplish in increasing access to psychiatry. 68% increase in the number of patients served, and significant reduction in wait times for med appointments, reducing from 3 months to 3 days. We have made giant strides in some areas, all focused on being person-centered and increasing access. Being able to offer people in our community who are struggling with addiction, who are ready to go to detox, the opportunity to go to detox, even though we don't have those services here in Douglas County, and to do that regardless of what their health insurance status is, whether they qualify for block grant funds, whether they're male or they're female, kind of addressing those equity issues and those healthcare disparities that by definition a person who is suffering from addiction or serious mental illness experiences, just because our system is just not up to the challenges that we face at this time. We need a system that's sustainable. And commissioners, you have asked some really good questions about what is the funding model, what is the vision for how we make this sustainable, so that the county's support can so that we can count on it, and flexibility and adaptability, because the world changes in the drop of a hat. We have spent the last 6 months, 7 months, responding and having to sort of think about adapting to the changes that COVID presents to us. And the behavioral health system is no different. It's constantly changing, constantly evolving, and constantly throwing new challenges at us. So those are kind of the 4 overall goals of enhancing the crisis continuum of care. We took one step toward trying to do a better job meeting the needs of people who showed up at the emergency room in the midst of a crisis, because the emergency room in this community is really the front door, the only door that's open 24/7 in our community at this point and at this moment. And we're trying to take steps to to make sure that we have better, more appropriate front doors, and that we have no wrong door to access crisis services. So the idea of the integrated crisis team was to create one team, embed behavioral health crisis clinicians and peer specialists in the emergency department, improve access to community-based services, whether those are SUD services, substance use disorder services, or crisis stabilization services, or additional outpatient services. We wanted to support patients with intensive care coordination following discharge. The feedback we've heard again and again is it's just too difficult to navigate this system. So intensive care coordination puts somebody with a person who leaves the ED in crisis or following a crisis, following discharge, and they stay with them for 30, 60, 90 days to ensure that they engage at Burt Nash, or they engage at Heartland, or they plug into the resources that exist in the community, even though sometimes it can be difficult to navigate toward them and to stay connected with them. We want to close equity gaps, which I've spoken about. And really the key to all of this is collecting and sharing data that challenges the assumptions that we've had moving forward on this very complicated project. So the result of that has been a team of 4 people and supported with a small number of half-time peers, 6 half-time peers up to this point at the LMH ED. And also simultaneously, the Burt Nash Access Center also handles and receives and works with and welcomes people who are struggling into their facility and over to the Community Mental Health Center Monday through Friday, 8 to 5. This current configuration is not adequate. It is not a 24/7 system. It does not prioritize the right setting, least restrictive type of environment. And so what we're trying to do is to move toward that. So what we proposed and talked to you about 5 months ago, was a plan to expand this experiment with a couple of objectives. One is to build the workforce. If you look at the projections for what it's going to take to run the crisis center, we're going to add, about 40 full-time jobs to this community. And that's what it's going to take to run that center. We need to do some work right now to start to build the workforce, to give them time to learn how to work in an integrated way, to work through policies and procedures and workflows and protocols that are going to have to run very, very smoothly when that crisis center comes online. And we want to do that, continuing to embrace and promote this integration, because there's so many benefits that we've seen already in working together. So building the workforce is an objective, expanding access so that we are doing a better job of meeting people where they are. One of the components of this proposal would take Burt Nash's Access Center hours to 8 o'clock in the evening during the week. That will mirror what the Crisis Center will do when the Access Center team moves over to the Crisis Center. The Crisis Center will be open 24/7. The Access Center or front door of that center will be open from 8 in the morning till 8 o'clock at night. And on the weekends, it'll be open, let's say from 10 o'clock till 2 o'clock on Saturdays and Sundays. We need to take some steps now to start expanding that staffing base that will be required to do this work. We need to give Burt Nash and LMH some time and some space, and to give the people that are doing this work the opportunity to start to work now and to flex between these 2 settings and these 2 teams. So there's some complexity there, and that's what this proposal is designed to get started doing. Taking some steps to integrate peers. We now have SUD peer mentors embedded in the emergency room. We continue to use the peer fellows, Burt Nash peer fellows, to support the work of the behavioral health crisis clinicians in the emergency department, all with an idea of intentionally placing that spirit of hope, mutuality, lived experience at the heart of the enterprise to meet somebody when they're in a moment of time where it's just really difficult. And Commissioner Kelly, you've asked some questions about, well, what are our volumes and what are our assumptions about revenues and expenses? And we can give you some answers of what we're projecting those to be. But it is time to start testing some of those assumptions by doing this work differently and more aligned in the way that we're going to do this work when the crisis center comes online. In June, we talked to you also about the opportunity to pilot mobile response, and we still very much want to move forward and make progress on that. Things have slowed down a bit with the discussions of the mobile response project and process. So I'm not going to speak so much tonight about that. We're not going to focus so much tonight on that aspect of the proposal that we were hoping to bring online sooner, not because there's a problem, but just because those conversations are proving to be a little bit more complicated, and we need a little bit more time to make sure that we're ready to go and move forward. But what we do want to do is share with you a plan for adding staff, increasing funding, increasing some funding from the county to narrow the gap between revenue and expenses for this work that would do those first three things: build the workforce, expand access, and integrate peers. What LMH and Burt Nash are proposing is to add 4.9 full-time equivalent positions in the following ways. We want to add 0.2 FTE specifically to the Burt Nash Access Center in terms of a crisis clinician, and we want to add 0.2 FTE to the behavioral health crisis clinicians so that we have that full-time staffing available as we had projected it before when we started this project. Then the other positions are 2.5 FTEs for evening weekend ICT crisis clinicians, one of whom could move into the role of a mobile crisis response team member when that work moves forward. In the meantime, could support the access center and continue to support the needs and volumes that we're experiencing in the emergency department. One full-time crisis support worker, one supervisor, because if we're going to function 24/7, this team needs to have backup, needs to be able to know that they can go on vacation, and that doesn't mean that the service comes offline or is not supported. So we need supervision that flexes both from during the week into the weekend. So what we have proposed is a staffing model that would do this. You have an executive summary from Derek Hurst, the director of the Integrated Crisis Team, and Burt Nash and LMH for how they see that moving forward. I just wanted to sort of tee up the big picture. I think a lot of things could be resolved with some Q&A and answering your questions.
Thanks, Bob. Sorry, I was having a hard time finding the mute button. Commissioners, do you have any questions on this item?
I do not.
I only have one, and I guess it's more just a reassurance, but it would help me again to hear the hours of the access center. So the entire access center is going to move from the Burt Nash building to the crisis center. And the access center hours are again, what, on the weekdays and then the weekends?
I'm going to let Stephen answer this. Currently, the access center is open from 8 to 5, Monday through Friday. What we envision when the crisis center comes online is that the access center will be open from 8 to 8, Monday through Friday, and then weekend hours on Saturday and Sunday of about 4 hours on each of those 2 days. Stephen, do you want to maybe speak to how you see things progressing to get from point to point? Because I think what we were talking about with this proposal was moving toward a situation where the access center would be online soon till 8 o'clock at night, but I don't want to say something that's not accurate.
Yeah.
And if Stephen, let me also ask, as part of that, this includes children as well, right?
Commissioner Thellman, all of this does include children. So this crisis team would serve across the human lifespan. The intent is that we create one team that will float between LMH Health and Burt Nash. So no matter who your paycheck comes from, you're part of this one team. 8 a.m. to 8 p.m. under this proposal, we would have the access center at Burt Nash open. That would be an expansion from our current hours, which are 8 to 5. And this staffing allows us to do those expanded hours. And then once we have the staff on board, we would work with LMH to create this one team and to be open until 8. So we do anticipate that once we've recruited and onboarded these positions, we will extend our hours. And then I think leading up to the opening of the crisis center, we can have conversations around those weekend hours. The intent when the crisis center is open, at least early on, this could always change, is that we would be available to the community for, I think it's 8 hours total on the weekend, with those hours kind of to be determined. But this one team concept is really critical to making all of this work, and a commitment between LMH Health and Burt Nash that we are going to be there for each other and therefore the community. And I'd just like to say that wouldn't have been possible without Jeanette Kirkpatrick and Derek Hurst and Nicole Riles and Aaron Newton from Burt Nash, who have worked really hard to bring two really complex organizations together in a new way. Sorry, that was a very long answer to your question. I just had to add in the touchy-feely stuff there at the end.
Oh, no, I think that's a great thing to bring up, because it is complicated and it is hard to marry two really big, complicated organizations around and create this new team. But you, talking about it, mentioned in kind of an interesting angle that regardless of where they get their paycheck from, they'll be committed to this team. So who is their boss? I mean, who do these people answer to?
So I think one of the things that Bob Trayansky has been really good at challenging us with is that collaboration and creating for the community member an experience where they don't even know whether it's a Burt Nash or LMH employee. So our plan is to create a leadership team or supervisory team that is representative of the ICT members. So it will include leadership from LMH and from Burt Nash. We've had some very preliminary discussions about including Heartland Radak in that, but they will get support. The staff will get support from a variety of supervisors working for a variety of organizations, which I think is really neat and really cool.
Absolutely. Thanks a lot, Stephen.
I have a couple of questions. For one is, when I looked at the review, there's a range on the budget between, like in the first year, between 63,000 and 88,000. And then in the second year, it's between 311 and 645. But that's not the proposal we have for us today. Can you sort of walk through that difference in numbers? Just how you landed on what you have proposed for us tonight?
Let me take a crack at it, and then I'm going to turn it to Derek a little bit.
Okay.
At the moment, the Integrated Crisis Team project has a couple of components to it. LMH is funding and supporting the role of the Integrated Crisis Team Director. The county is supporting the existing behavioral health crisis clinicians and some of the peers that are working in the emergency room at the moment through the Peer Fellows program. And LMH is covering the health insurance costs of those employees. That's the core of what's happening right now. It's nice and neat because all of those employees are LMH employees. Now we start to expand things, and we have SUD peers and what have you. So what we're proposing to do here is we have the opportunity now, which we've been challenging Burt Nash and LMH for about a year, to say, how do we offset some of the cost, which is at this point being borne almost exclusively by the county for these crisis clinician positions, through some opportunities to recover revenue. And through the partnership between Burt Nash and LMH, they are doing that. So what you see is some projections about what we anticipate and project we might be able to recover through revenue generation. I'm going to let Derek talk specifics and answer specific questions, but I am convinced, and Sarah, jump in if you disagree, that they have been very conservative on the projections of the revenue potential here. And so I feel like this is a really fair proposal, more than fair, in terms of what we're being asked to consider doing as the county, in terms of making a commitment to cover that gap between revenue and expense. Right? The county is not being asked to carry all of the staffing cost of this. It's being asked to cover the gap between revenues and expenses, to do that work. And we're going to need to be flexible in understanding, what some of the other costs are involved here. Administrative overhead plays itself out in different ways in different institutions. Healthcare costs play themselves out in different ways at different agencies. And I am absolutely convinced that our partners are doing everything they can to make this the most efficient, effective approach to that's going to require county support. So Derek, I've talked too much. Do you have some sort of like details or elements you'd like to illustrate?
Yeah, no, I think you did a great job, Bob, of kind of explaining that pretty succinctly. And so that range really does kind of, show, like Bob said, our conservative estimates of what some of that kind of revenue, realization might be as we work towards this program. And that's based off of a lot of really, detailed work and looking at a lot of different circumstances. We did go conservatively just because we wanted to make sure that that we had kind of, a worst case scenario, if you will, which is that higher part of the range. So should we run into some issues with trying to realize the expansion, we wanted to make sure that we accounted for that. However, my hope, and I think, I can say the hope of the team, we talked about this, is that we far exceed those, and the cost may even be less than this, because we know that every dollar that we can save of this kind of county funding that we have for behavioral health crisis, every dollar that we can save and get reimbursed and paid for through other avenues that should be handling part of that cost as well, is money that can go back into crisis funding in other areas. And that speaks to the mobile crisis response project that Bob is kind of talking about, and other options as well. So we're really driven here to make this a lean and efficient machine that provides the best possible services for individuals in our community, and does it in a way that, especially efficiently cost-wise, so that we can, provide even better and more expanded services in the future.
So one other thing, just again, big picture, when we projected or proposed this integrated crisis team project 2.5 years ago, we proposed and projected that the cost of this project would be about $397,000 a year. We've operated this team at a cost to the county of about $250,000 a year. And what we're projecting to do now is that this cost could go as high as $520,000 a year. So it's a significant increase, but also keep in mind that the intention here is that this really is a bridge of 12 to 18 months to get us into the staffing model in the crisis center. The cost of this will be absorbed into the operational plan and the funding model for the crisis center. And like I said, I want to affirm and emphasize this. I can't say enough about how hard Burt Nash and LMH are working together to figure out how to do this in the most cost-effective way, so that we can use precious taxpayer sales tax dollars to invest in care for the people that need it and for the people that aren't covered with services or insurance, or they need help and the resources are not there to provide that help. Somebody's got to fill that gap, and somebody has to carry that burden, and we can't just throw that to community agencies and say, good luck, because there are real costs, and sometimes those costs are not dollars. It's bandwidth and people's energy levels to be able to do this type of intense work every single day, and to show up for work the next day and know that they're prepared to bring their A game to meet people's needs.
Yeah, I just really want to say how much I appreciate you walking us through that, because this is new territory for us. I think as a governmental agency, the reimbursement dollars and how that works is unique when you're considering, we go out and we buy a road, we purchase this much salt. This is a complex system that has to have some estimates on it, because we don't know what the clients will be coming with and what reimbursement dollars. So I just think it's important for the public to sort of hear how that works. There's tremendous work being done by you all, and I really appreciate the thought that's gone into this. I just think as we talk about it in the community, we need to make sure that the community is understanding how it's funded, and that it really is coming from multiple partners, and also through reimbursement dollars. That was hard for me to get my mind around originally, and because I just think it's not typical. I'm afraid I might be misunderstanding it now, but I think I've got it.
No, you're right
But
on.
yeah, those estimates are tricky. We don't usually do this wide of an estimate. And I just think that's important. And as long as you all are confident that we can work within, those behavioral health dollars we have, if I remember right, that's a huge step from where we were months ago when we were struggling to sort of make a budget work here, that we thought we could provide these services. So if I'm saying anything that's incorrect, please correct me, because I'm mostly asking to get these things out in the public so they can hear.
Patrick Schmitz, do you have, I noticed you were.
Patrick, this is Patrick Schmitz. I would say the county does have some experience with this in terms of their support to Burt Nash. And the work that we do. You help cover some of our gap, and we have to figure out the rest of it. The difference is we haven't started up a significant new program like this in a long time. And so it feels like uncharted territory, but it's not completely. And we've been working on this for a long time, and it's those four people, Bob, Stephen, Jeanette, and Derek have done a lot to really refine this. It's still a lot of no perfect formula, but they've done a lot of tremendous work, and it's not completely unknown. So I just wanted to add that. I really wasn't planning on participating, so but I thought you raised a good opportunity for me to say something. So thanks, and I'll get out of here.
I think one other thing that's important to emphasize is that this approach, what we're proposing tonight, it gives us the opportunity to test some of those assumptions that are embedded in this financial projection. On a small scale, while we still have the opportunity to recalibrate or adjust or seek additional funding from the state. I mean, whatever it's going to take to have the sort of that cluster of resources that we're going to need to do this well, because everybody on this call is just absolutely committed to doing this well. Not just getting it done, but doing it right.
Yeah, it's certainly. Thank you for re-emphasizing that, Bob. I appreciate that. My only other question, and I really wasn't going to ask about this, but I've changed my mind, is I know that mobile crisis response is complicated, but there's been a lot of conversation in the public about how we might respond differently when, and you used the graphic earlier about, those intercept points where it could be police coming, they may show up at the ED. And then you said you're taking a bit of a step back in mobile crisis response. Could you just maybe give us a little bit of an idea of sort of what you're thinking going forward, how what's coming out of the crisis center may be different than how the police might respond differently? There's just been a lot of conversation about that, and would interested to hear from this group sort of where your thinking is right now. I expect that it's probably changed over the last few months.
So I'll take a crack at it to start, and then I want Stephen and Derek to weigh in here, and Patrick, of course. Here's an example of learning that I think I have done. The most important component of the crisis system we are building is our ability to meet people where they are by responding to them in the community. It is the most important piece of that puzzle. Now, the interesting thing with the way that we've approached this in Douglas County, for varieties of reasons, is that it is the one dangling component that we did not define from the beginning. So we have a number of efforts to respond mobily in the community, right? We have a co-responder unit that's a partnership between Burt Nash and LPD. That unit is online 10 to 7, Monday through Friday. So there's a lot of time that unit's not online. There's a real need to be able to go out and meet people's needs before they come to Burt Nash, or that maybe they wouldn't take the step to walk into outpatient services at the Community Mental Health Center or at DECA. And that figuring out how to go from where we are, which is really baseline, to what we need to be, it is complicated. And there's energy in the community, that a mobile crisis response team could replace a law enforcement paired team. And our partners at Burt Nash are telling us, no, you want to build one on top of the other, and you want to blend it appropriately. You want to have an air traffic control crisis line dispatch process that sends the right people out into the community for the right reasons. So this is complicated. I think the CJCC has taken a big step to say, we're going to convene a work group to map this out. It's taken a while. COVID has not made it easy to get that work group up and functioning, but I think we have that work group in place now. And Burt Nash has put together some proposals about what a mobile crisis team would look like coming out of the Community Mental Health Center. And there are other ideas in play as well. And I think we need to, as quickly as possible, really evaluate the proposals that people have looked at, and ask ourselves, are there other things that we should be considering so that we can move on this? But we're trying to convene the stakeholders around this issue the same way we've convened the stakeholders around a crisis center, housing, those types of things. And if we had listened to Patrick 3 years ago, we would have done that first. And we haven't, because all of our energy has been focused on the crisis center for good reasons, right? But we, again, you want to do that right, and we want to bring it on. We want to start to bring it online as soon as possible, because as soon as you bring that online, that starts to reduce the strain that our emergency systems are experiencing. Stephen,
I don't know that I have anything to add, Bob. I think you kind of got where we're at and where we want to go, which is we're working to get all of us kind of rowing in the same direction. And I think, from my perspective, the mobile response team sort of is an extension of and supplement to the crisis center, supporting law enforcement, supporting the hospital, meeting people where they're at in the community, deploying, going to them rather than having them come to us. And I'm confident that together, like we've done with all these other big things, we'll get mobile response tackled over the next months and year as we build up to the crisis center.
There's some capacity in this proposal before you tonight that we could start to take steps forward when and if those stakeholders say, let's take the next step. I mean, that's that one position in particular. And Burt Nash has kind of proposed a 3-person team, 3-position team. And I think we could get there quickly once we have agreement and consensus about what the right next step is.
Commissioner Kelly, I just add too that I think that this topic of alternative response models that have traditionally been in law enforcement is a very, very broad topic. Mobile crisis response is much more narrower. It's definitely about crisis, and it's about people who are experiencing behavioral health and addiction crises. It isn't necessarily homeless community outreach, which can sometimes, that's a different thing. It isn't necessarily it's not going to meet all the needs of folks that are looking for alternative response models. And I think one of the things we're going to have to spend time on in the next 6 months to a year is really learning more about that, talking more about the differences between those things, talking about the proper role of each professional in that place, and what needs to be done. I think at a community and at a public level, we have a very shallow, wide understanding of what this is. And I think this is our next challenge as we get the operations of the crisis center more solid, is to all of us to collectively learn more about it and really hone in on what it is that we want to accomplish.
So I have a question kind of over all of that, because just wondering who is in charge of the mobile crisis response initiative? Is it, we have the CJCC involved, we have Bert Nash involved.
It is a work group of the CJCC. It is chaired by Kevin Joles. It is supported and facilitated by Stacy Cooper at Heartland Radac, and the stakeholders at the table are Nicole Riles from Bert Nash and Monica Kurtz and folks from the headquarters team, dispatches at the table. All of our law enforcement groups are at the table. Our consultants from Connections are at the table.
Okay.
It has taken a while to assemble the table of players and to start to focus that. And quite honestly, I don't think we did not do a great job of launching that effort. It was not made easy by the global pandemic. And so I want to express some ownership and to say to our partners who feel that they are ready to move forward, that I can hear and feel your frustration in terms of, like, in some ways, parts of this are not brain surgery, right? And on the other hand, you don't just want to deploy something without a well-oiled. We don't want to build some siloed attempts here to make steps forward.
So, and that's a great explanation, and thank you for that. I guess I still just, in the end, we know how hard things are to organize from start to finish and to implement and understand all the ins and outs and keep all partners kind of married happily as much as possible. So over it all though, Bob, are you the coordinator for it, or is Mike Brower the coordinator for it, or is Stephen the coordinator? I mean, who is ultimately the one who has to kind of be the puppet master to get folks in a place where it can happen?
I'm going to let Sarah answer, but I believe the answer to be Mike Brower, and he and I are working very carefully together to make sure that this is a criminal justice and behavioral health effort, and that's new. So
yeah.
But the work group lives with the CJCC, and the subject matter expertise is being provided by the players on the integrated crisis team. So.
Yeah, I'd say Bob's right on that. And in addition to that, we recently have Kevin Joles with Lawrence Douglas County Fire Medical is the chair of the group. So we've had the city of Lawrence engaged, from the start, but even now as their conversations are evolving around alternative response models, we're having additional conversations with the city manager's office and continued coordination. That was a big deal to us, is that we didn't want two different committees and another subgroup over here working on it. This is the one group studying this work.
Right. Well, that's exciting. That makes a lot of sense. And it's kind of wonderful to think of pulling in new partners to have the city be a serious partner in all of this and bring the CJCC into more direct contact with the behavioral health side of things. So that's great. Thank you so much. That's hard work right there.
Yeah, that's exciting to hear the work that's happening with CJCC, and I'm happy to hear Stephen say he's confident that we can figure this out with all these new partners. That's awesome, and I expect that you will. But one of the reasons for asking the question was I don't want the public to get the sense that, oh, we've already figured out these alternative crisis and let's just sub that over. That's not what's happening here. It takes a much deeper conversation with a whole lot more partners. That wasn't the intent of the early mobile crisis response discussion early on. And I just wanted to make sure that the public knew that. So
Patrick, this is Patrick Schmitz. I would liken it very much to the process that we went through with the crisis center. It was a very narrow set of people involved in it before, and now it expanded to include more partners, and we're going to have a much better result and a whole lot of new opportunities. So I think, Bob said, had we listened to me 3 years ago, you know what, I think what we're going to end up with is a really good product at the end and a whole lot of new ways of working together. So the time it took is the time it took because it was needed. So I think it was good.
any other questions, commissioners? Thanks for that discussion. Really appreciate it. Let's check and see if there's any public comment. Sarah, anybody there at the courthouse on this item?
No, we have no one.
Anyone online? Jill?
Nope.
Okay. Well, I'm happy to make a motion on this one if that's okay with commissioners. I'll recommend to expand the Douglas County Integrated Crisis Team as proposed by LMH Health and Bert Nash at a cost not to exceed $88,000 in 2020 and $522,000 in 2021.
Second.
Moved and seconded. Any further discussion? Seeing none, all those in favor say aye.
Aye.
Aye, passes 3-0. Bob, thank you, and thanks all of your team for being here tonight and walking us through this incredibly complicated work that you've been doing. It's an inspiration to us all to see this actually coming together. It's pretty exciting stuff.
No, it's a real privilege to be able to do work like this with the support from our elected officials and our county government's support. It's a privilege to be able to do this work. This does not get done in other communities in this way, and we would not be here without the way that you all shepherd and steward and challenge us. So thanks for that.
And support and go out on limbs and really take risk with us. So thank you.
Thanks, everybody.
Okay, that takes us out of our regular agenda items, and we'll move on to any appointments, commissioners.
I don't have any.
No, I don't have any either. Sarah and Michelle, thank you for getting us I'm working on the
Community corrections.
community corrections. Thank you. I knew it had C's in it, but I couldn't remember what it was.
C is the letter of the day. Challenges, complications.
At this time, we have general public comment. It's at the end of each meeting with a limit of 1 comment per person. The commission reserves the right to place a time limit of 3 minutes per speaker if desired. Individuals may not give unused time to other speakers. As a general practice, the commission will not discuss or debate, nor will the commission make decisions on items presented during this time. Rather, they will refer to the items to staff for follow-up if necessary. All comments should be directed to the county commission. Sarah, is there anybody at the courthouse that would like to provide public comment?
Nope.
Jill, anybody online?
No.
Thank you, Jill. Thank you, Sarah. All right, we'll move to commissioner or administrator miscellaneous, and we'll start with Sarah.
Thank you, commissioners. In your packet, you have a memo, an updated memo for this week. We have added a couple of scheduling events to the memo. Specifically, the quarterly judges luncheon is scheduled for Friday, November 13th. I think we're still working on a location for that, but that'll be at noon. And we have heard from the county clerk as to a date for the general election canvass. And so we need to, if commissioners cannot attend the canvass, we need to be able to have additional folks there. So please let us know. I think we're working, I think it might be in person. So, but we're working on those, that information with the clerk. And there's a lot of stuff in this week's memo. I did want to specifically pull out a few, I had Cami pull together a sales tax update for the commissioners, and we spent a lot of time talking about sales tax numbers at budget time. And so I've had Cami monitoring our sales tax collections, and I'm really pleased to announce, commissioners, that in the 2020 adopted budget, we budgeted $7.2 million for sales tax funds. When we worked on the reestimate and during the 21 budget process, we lowered that number down to 7 million, reflecting a 10% reduction to be conservative with COVID and the impacts on our economy. Based on our actuals to date, we've already collected through October over $6.1 million. So we're on track for 2020 to receive $7.3 million, which is above our adopted budget and substantially more than our reestimated budget. So that's a really good sign. We're generally very conservative in our sales tax estimates anyway, which I think, has proved us well in this situation, but it's really great to see that our estimates are back on, and that our collections are back together. And Cami included information for both the numbers I was reciting were for the general fund for the 1 cent sales tax, but will be similar for the mental health fund and the new behavioral health sales tax. So I'd be glad. I just want to make sure commissioners have that. And we'll give you a report again, my hope closer to year end, just to make sure that we're staying on track with that. And then Cami's detailed spreadsheet that you see at budget time for sales tax is also included in that packet as well. But with that, I stand for any questions the commissioners might have.
Thank you, Sarah. That's just hard to believe that we're going to be ahead of sales tax projections on our original. I mean, I just never would have thought that. So.
We're really seeing that, people are still spending money. It's, there's still things, it may not be coming from tourism dollars, but folks are still contributing to their economy, which is great.
Commissioners, any other items for general discussion?
Yeah.
I know we'll talk about this at the canvas, but we have to commend our county clerk, Jamie Hsu, for the tremendous work that was done, and I'm sure is still being done right now. Jamie was pretty emotional when he came to us after the primary, and just at the work that it took to pull this off. And I'm sure, looking at those numbers, it just has continued to be astronomical work. And I just want to publicly appreciate Jamie and his entire team and all the volunteers who are out there making this happen, because this was just an awesome situation, and they just came through. I can only speak from my own experience and from hearing from others that it was such a pleasant experience voting, and just really appreciate all the work that was put into it. And just wanted to say that for Jamie and his team. With that, if there's nothing else, we are adjourned.
See you Friday.